Minnesota hospitals continue to be crunched for space. This next story is a reminder of the domino effect the pandemic is having on all kinds of health emergencies. This latest map shows 81% of adult ICU beds across the state are full, with very few beds available at all. WCCO's Liz Collins shares what happened when one Twin Cities woman needed help this month after a simple trip to the mailbox.
And next thing I know, I'm down. My right leg went out from under me and I ended up in a sitting position on the ground.
That trip to the mailbox for Lori Jurgensen on December 11th ended in a fresh pile of snow and a snapped ankle, a lateral break with fractures on both sides that required surgery in 12 to 24 hours to minimize damage.
And the point is they need to do it quickly ahead of the swelling.
But she soon realized after her ambulance trip to Woodwinds Hospital in Woodbury that timeline wouldn't be possible, as medical staff pointed her to a large number of unvaccinated patients sick with COVID awaiting care.
As we're going through and entering from the garage entrance, I'm looking around and there's people everywhere. I was like, okay, this is it. This is what these stories are about.
There wasn't a single bed available in the Twin Cities for surgery. Instead, Jurgensen went home in a wheelchair, where she'll be until her surgery later next week, an 18-day delay and facing the risk of permanent damage.
It isn't just Lori that's suffering, but other people too.
Jurgensen's friend and neighbor, Joanne Bauman, is a retired nurse.
This is not a political issue. This is a public health issue.
She hopes what happened here shows the spider web the pandemic is weaving and the power she says some still have to stop it.
I think that people are choosing not to be vaccinated, but not really thinking about what the repercussions are.
Liz Collins, WCCO 4 News.
Jurgensen says she will likely be wearing a prosthetic shoes on that leg the rest of her life. A spokesperson for mHealth Fairview at Woodwinds said in a statement that it is experiencing extremely high patient volumes, driven primarily by an increase in avoidable hospitalizations as a direct result of COVID-19.